This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Okay, you ready? Take most everything you thought you knew about blood pressure and toss it out the window. We're going to take you completely out of your comfort zone here.
Yeah, because blood pressure guidelines have changed. What you thought you knew might not be the case anymore, so let's try to sort it all out.
Yeah. Here to help us is PRMC's Chief of Cardiology Division and Medical Director of Cardiac Rehabilitation. This is Dr. Jeffrey Whelan. Thank you so much for joining us this afternoon.
Thanks for having me.
So this is really becoming a hot potato of conversations here. What is going on with these new guidelines?
So in November of 2017, the AHA and the American College of Cardiology came out with new recommendations for blood pressure control. And historically, the numbers were 140 over 90. If you're under that, you're good. If you're over that, you need to be on medicine. And if you were over 60, they'd let that upper number go up to 150. Now,
so these are the new numbers?
These are the new numbers, and you can see there's a dramatic reduction. You're considered slightly elevated if you're up to 129. If you're in the 130, 139 range, you're in the stage 1 hypertension, and over 140 and 90 is stage 2, which is the sort of classic definition we've had before.
Oh my goodness. Okay, so what inspired this change?
There was a huge trial that was published in the New England Journal of Medicine called the SPRINT trial, and they took 10,000 people and they randomized people into standard treatment and intensive treatment, and the intensively treated patients had less heart attacks, less heart failure, and improved overall mortality. So they broke the trial early, and that has led to these new guidelines.
Well, I was going to say, I mean, we've been talking heart health all month long now, and high blood pressure. Okay, you just mentioned a whole bunch of things, but high blood pressure, I'm not worried about that, right?
Well, the thing about high blood pressure, you know, they call it the silent killer because it has no symptoms. And so when you don't have any symptoms, you tend not to worry about it.
Right.
And taking medication to improve your blood pressure doesn't make you feel better. It does, you know, reduce your likelihood of having heart failure or kidney disease or stroke. But that's the reason why I think, you know, a lot of people say, well, high blood pressure, what's the big deal?
I tend to blow it off.
Yeah, exactly.
So well, let's talk a little bit about high blood pressure and symptoms. What are they?
There really are no symptoms. That's why it's called the silent killer. And what happens is people will go in for routine checkups with their doctor, or they're giving blood and they have their blood pressure test, you know, tested before they donate blood, and they'll find that their numbers are up. And I think if you find your numbers are up, then you need to really strongly consider, do I have this problem, and how do I deal with it? First thing to deal with, way to deal with it is to make sure these numbers are accurate. So. You know, people have this, what we call white coat syndrome, where their blood pressure goes up when they're in a doctor's office, and oftentimes, you know, repeating the measurement in a different setting will lead to a more accurate estimate as to what your blood pressure is.
So I have a little home blood pressure monitor for the wrist, and you were telling me.
So it's just an over-the-counter thing.
This is just an over-the-counter thing, but do you recommend that people have these?
We do recommend it. We do recommend it for exactly that type of patient who comes into the into the office and their blood pressure measures at, let's say, 160 over 100 or whatever, and they say, well, you know, doc, when I check it at home, it's always good. And that's important. And so when we're making decisions about whether to treat people and how aggressively to treat people, we want to make sure that we're treating people who need to be treated and not over-treating people who don't need to be treated. So bringing in a blood pressure diary to your physician that you've measured at home is very helpful.
So I actually had always had low blood pressure throughout my life and never worried about it, but then I turned 50 and then all of a sudden my blood pressure was elevated. Is that a common thing? Do people all of a sudden get high blood pressure?
So as you age, your blood pressure tends to go up, and it's probably related to some of the elasticity in your body in general. As you know, you tend to get more stiff and tight and less flexible. Similarly, the blood vessels have less elastin in them, and they tend to get more rigid, and so there's not as much flexibility, and the blood pressure goes up.
So are these things accurate? Can we trust these?
Yes, they are. And the one caveat would be that if there's some major discrepancies, is to bring the device in when you're seeing your physician and have the physician corroborate that it's measuring accurately. But generally, they're quite accurate.
All right, let's talk about how to get the numbers where we need them to be. What do we need to do?
So first and foremost, which we always talk about with heart disease, is lifestyle and healthy habits. Typically with high blood pressure, like many of the other cholesterol issues, it's eating healthy. In this case, we're trying to avoid salt. It's weight loss and making sure you're not stretching the waistline. And it's exercise, and again, the exercise is helping with burning calories and preventing some of the weight loss issues.
All right.
We can handle it. We can beat it. We can live
Well,
with
yeah,
it.
and then if those efforts don't work, then we've got some great medications. And it used to be that our pharmacy selections were limited. We've got a lot of medicines that are very effective, that you only have to take once a day, and that don't have a lot of side effects. So yeah, if you need to be on medicine, we've got something that'll work for you.
All right.
Dr. Whelan,
Thank you
All right.
so
My
much.
pleasure.
Very good information. Peninsula Regional Medical Center.